Welcome everyone to this webinar. This is actually the second time we've presented this. We ran into some technical problems last week. This webinar on evaluating substance use prevention plus wellness programs. I thank those of you that, for those of you who have the perseverance to return a second time for this session. And my apologies for last week's technical problems. So this week, we are recording this, and I will send all of you who have registered for today's session a link to this recording. I did make a couple of little small changes to the slides, so I'll send you a PDF of the slides as well. And a certificate for 1 hour CEU for joining us today. So this is a new webinar, if there is a problem with you seeing slides as I go through them, please let me know, and I will pay more attention than I had last week when we had some issues with this. So my name is Dr. Chudley Wirch, and I'm the CEO and founder of Prevention Plus Wellness, LLC, located here in beautiful St. Augustine, Florida. Thanks for joining us. And let's go ahead and take a look at the objectives for today's webinar. The first are to identify purposes for evaluating substance use prevention programs. I've got a few of them that come to my mind very quickly. And if there's some extras that I may have missed, let me know. You can certainly participate in today's training by just going to the chat space and typing in any questions or comments you want, and then at the end of today we'll address those. So we're going to look at the purposes for evaluation, the critical purposes, I would say. I'm going to describe for you the measurement tools and the measures that we use to assess substance use prevention plus wellness programs. Thirdly, we'll be examining evaluation designs to determine both risk protective factor and behavioral effects of prevention programs. And then lastly, we're going to explore some case studies of PPW, that's Prevention Plus Wellness Program evaluation. So you get a little sense of the data that we've collected over time. Okay, everybody good? You ready with that? Thanks again for joining us. I really appreciate it. And let's take a look at the content, starting with purposes for evaluating prevention programs. So here's really 5 that I could come up with, which I think are very important. Number one reason, one purpose, one goal for evaluating a prevention program is to determine the fidelity of program implementation. If your program is evidence-based, as ours are, and in fact we use an evidence-based practices screening and brief intervention, it's important to implement the programs as they were developed and designed to be implemented. So this is a hallmark of a successful evidence-based program, and that is implementing them properly. So really, really important to do that. So, I mean, it just makes sense if, to give you an analogy, I suppose, if you were, I think the one we gave last week was, let's say that you were prescribed by your physician to take antibiotic medicine, and you didn't follow that script, and you only took half of your script, and in fact it said use the whole bottle and you only used half of it, that could really reduce the effectiveness of that antibiotic. Same with a fidelity of a prevention intervention treatment program, and that is it has to be implemented in the entirety and as it's designed to be implemented. If your medicine that you're taking is supposed to be taken on a full stomach, you should take it on a full stomach. Not only could that increase the effectiveness, but it can reduce side effects. So again, same with program fidelity. So that's one reason to evaluate your program, and not just to evaluate, but to monitor fidelity over time to make sure that you're implementing it. You could certainly implement the program with fidelity 1 day or 1 week or 1 month, but are you doing that consistently over time to ensure the greatest outcomes from your program? That's evaluation. Secondly, to assess program outcomes. Certainly you want to know that your prevention program is reducing risk factors, is increasing protective factors, is influencing health behaviors, substance use behaviors, and other health behaviors. And so you really want to determine the outcomes. If a prevention program is powerful enough to have positive outcomes, it could have negative outcomes. So you want to measure both positive and potential negative outcomes of your program. Where they are, with whom, circumstances, what seems to be linked with the greatest outcomes, and so on. So there's a lot of questions there, but assessing outcomes is essential for you to determine if you're moving in the right direction and getting what you want and need out of your evidence-based prevention program. So that's number 2 reason for evaluation. Number 3, to provide data for improving your program. Certainly you want to get feedback on your program to improve it over time. That's why you want to monitor over time fidelity, outcomes. Are you achieving what you need over time? If not, then you need to make some changes, some improvements to increase the effectiveness of the outcomes that are desired. So really, decisions to improve your program, even with an evidence-based program, it doesn't matter. The program that's evidence-based has been shown to be effective with certain populations in certain settings under certain circumstances. And so every time you implement an evidence-based program, things change. There's so many variables involved. And so that's why evaluation is critical. And you need to have that feedback to make sure that you can continually improve your program over time. Fourthly, to collect feedback to promote your program. We oftentimes forget this, but this is so important. You need to sell your program to others, to funding agencies, to communities, to parents, the organization, to kids themselves or young people that you're implementing it to. So another critical reason for evaluation is to get that feedback to turn around and to really promote your program to all the stakeholders that are involved, from youth all the way through funders, through parents, and so forth. And lastly, number 5, contribute to the research and the evidence base in the prevention field, the research and evidence base in the prevention field. You may not really realize this or think about this, but to the extent that you share the results of your program, the fidelity, the effectiveness, the feedback at conferences, online, through your colleagues, through webinars, with us as providers, as developers, I should say, that you're actually contributing to the broader field of prevention research and evidence. And so it's very, very important for that perspective. We're continually learning and growing together, developers, implementers, all of us in the field, through the help of providers and youth and families and so on. So we want to continue to move our field forward, and that's a data-based process. So evaluation, so very important and part of that. Let's take a look at the measurement tools and the measures that we have and that we use primarily at Prevention Plus Wellness. There are 3 of them. The pre-test and post-test surveys. This measures outcomes or effects of your program. The instructor survey, which is a process measure assessing the quality of program implementation, and a fidelity checklist, which helps you determine to what extent your program is implemented with fidelity. It's not yes or no, but it's actually a degree of fidelity. So those are the main measurement tools that we use that are provided to all Prevention Plus Wellness program implementers to monitor their program outcomes, process, and fidelity. So let's take a look at these a little bit more in depth. Let's start with the pre-test and the post-test surveys. At Prevention Plus Wellness, our programs offer pre and post surveys, both online and paper versions. So that you have that flexibility. the surveys, the pre-post surveys includes 3 risk and protective factor measures. These measures include 5 substances: alcohol, cigarettes, e-cigarettes, marijuana, and opioids, and 5 wellness behaviors, including physical activity, breakfast and nutrition, sleep, stress control, and healthy goal setting. The post-test survey also includes 2 qualitative open-ended items to help inform the quantitative measures that we just mentioned, the risk and protective factor measures on substance use and on wellness behaviors. So those are the measures on our pre-test and our post-test surveys to measure outcomes. Let's take a look at them more specifically so you better understand what I'm talking about. So this is the beginning of the survey. You have the date. A code number can either be provided by the implementer or can be self-generated by the youth. And that's just so that you can, you can match up pre and post surveys. A school location optional code if you want to look at outcomes by school location, and then 2 demographics, gender and age. And the surveys that we've provided, both in paper version and online version, take about 5 minutes to complete for the pre-test and about 7 minutes to complete for the post-test. And the post-test takes a couple more minutes because you've got these 2 open-ended items in the post-test. So that's why there's a difference between the time of completion for pre and post-test. So one of the risk and protective factors that's measured in our pre-post survey is behavioral intentions. Behavioral intentions is the most highly predictive measure of future health behaviors among young people. That's why we're using it. And in our pre-post surveys, we're asking our implementers, our providers, to implement the pre-test immediately before the lesson and post-test immediately after, so that you don't have to do a follow-up later on. And so because of that convenience, pre and post right at that moment of the lesson, you're unable to measure behavior. So you have to measure predictors of behavior. So one of the primary ones is a risk protective factor called behavioral intentions. We have measures of behavioral intentions on 5 substance use and 5 healthy behaviors, as I mentioned before. And behavioral intentions is measured on a 5-point scale of very likely to very unlikely. And just to give you a couple of examples so you can know what I'm talking about, is down below is, in the next year, how likely are you to get physical activity most days a week? So that's a measure of behavioral intentions of a wellness behavior. And between pre and post lesson, between the beginning of the lesson and the end of the lesson, what you're going to be hoping for, depending on how well you implement the program, how effective it is, risk levels and accuracy of measurement, that you're actually going to be increasing intentions to engage in the healthy behaviors: physical activity, breakfast, nutrition, sleep, etc. So that's a measure of the wellness behavior, behavioral intentions. Next year, how likely are you to get physical activity most days a week? So hopefully you would like to move youth toward the very likely, the 5-point scale, the upper end of the scale. The other example is, in the next year, how likely are you to take a drink of alcohol? So this is an intention we want to decrease or reduce. We want to move youth to very unlikely that they would intend to take a drink of alcohol. So that's what you're measuring. You're actually measuring 2 directions of intentions. You want to increase intentions of wellness behaviors, decrease intentions of substance using behaviors, and that's behavioral intention. So 5 measures of substance use, 5 measures of healthy behaviors. So you have 10 total measures of behavioral intentions on our pre-post surveys. Also being measured is another risk factor called perceived harmfulness. This measure, again, is of 5 substance use behaviors on a 5-point scale of a great deal to not at all. And one sample of the question is, if you were to use marijuana often, would it harm your health or healthy habits? And so what we want to do there is to increase perceptions of harmfulness to a great deal. That's the goal. So research shows that as young people perceive substances as harmful, they're less likely to use them, and vice versa. So that's why your PPW program specifically addresses harmfulness of, depending on what program you're using. If it's sport, it would be alcohol. If it's marijuana, it'd be cannabis. Opioid, PPW, obviously vaping addresses e-cigarettes. So whatever the case is, what we're trying to do is show to youth that engaging in these substances is harmful to not just their other healthy behaviors, physical activity, sports, breakfast and nutrition, sleep, stress control, but also achieving the benefits of those, including positive images, as well as their performance overall, whether it be in sports and school and life. So definitely a possibility to see change from pre to post lesson on perceived harmfulness. The third final measure is social norms. That's a risk factor where we have on our pre and post surveys measures of social norms of 5 substance use behaviors, again, on a 5-point scale of all to none. And as an example of a question, the last block there is how many people your age currently vape e-cigarettes. So we know that social norms drive substance use. We know that youth overestimate social norms, or in this case, the normative belief that most or all of their peers use these substances, and then that, of course, gives youth, in a way, permission to experiment and use the substances. So what we're trying to do is to reduce their perception of the number or percentage or amount of their peers and friends that are engaged in these 5 substances. So that's a social norm measure. Also, on the post-test, as I mentioned, there's 2 qualitative measures. The first is, what did you like best about this lesson? For example, how did it affect your health behavior, substance use, motivation, goal setting, self-esteem, etc.? And this open-ended item is very critical to getting testimony from youth as to how effective the program is. And so you can literally cut and paste these comments and share them with other youth and parents and coaches and teachers and funding agencies and community, social media, et cetera, so that you can really promote your program. And I think this, above all of the measures, should make you as a prevention health specialist feel good about yourself, because you'll see how successful your program is as you implemented it with your youth. So it's very, very, specifically focused on your youth. So good content there. And then the second open-ended question is, what did you like least about this lesson? For example, what do you think you should have changed or improved? We'll give you hints as to how you can improve your program. So these 2 open-ended items, what did you like best? What did you like least about your lesson, will help promote your program, improve your program, and also go back and help understand the kinds of data that you got on your social norms, on your perceived harmfulness, on your behavioral intentions. So these quantitative measures will help understand the qualitative and vice versa. So it's a very mixed methods approach. It's a more holistic method for conducting evaluation, because you're using both qualitative and quantitative measures. At Prevention Plus Wellness, we also have an optional health behavior survey, which includes 30-day measures of behaviors. So if you wanted to use this, these are the measures on your health behavior survey. We have 30-day measures of both moderate and vigorous physical activity, eating a healthy breakfast, practicing stress control, setting goals to improve health and fitness, as well as 30-day use of alcohol, cigarettes, e-cigarettes, marijuana, and opioids, and 30-day feeling sad or hopeless and being bullied or threatened online. Those last 2 items, we're sort of casting a little bit broader net on as to how not just healthy behaviors and substance use behaviors, but perhaps effects of PPW programs on mental health and on things such as bullying, violence. And the last measure is actually the number of hours of sleep. So if you wanted to, as an option, we do have this available, a health behavior survey that you can use before and after your lesson. Now, if you do that, of course, you can't give it immediately before and after your lesson. You'd have to give it before your lesson, and then you'd have to wait after your lesson at least 30 days, because these are 30-day measures of behavior. The instructor survey, that process measure, very, very important to monitoring the quality of program implementation, includes 7 measures, a 5-point scale of a great deal to none at all. And of course, what we really want is to hopefully move toward a great deal on all of these measures. So this is designed to be a self-assessment tool that you use at the end of presenting your Prevention Plus Wellness lesson, at the end of each lesson, or at the end of the week of providing lessons. So you can stay on track and keep remembering what's important for good quality presentation and communication when you present your lesson. A supervisor or manager can also use this as an observational form, can observe you present or practice, and then fill it out and then give you feedback using these 7 items. So 5-point scale, again, a great deal to none at all. Number 1 is level of comfort presenting the lesson. So we know that with practice, you'll get more comfortable, and comfort is an important indicator of practice. So we recommend practicing your scripts to implement your program at least 3 times, 4 times. Some of you will need more, but once you practice aloud your script coordinated with your PowerPoint slides, you'll be able to move toward a great deal of comfort, which is ideal. Secondly, active presenting strategies. Are you using good eye contact, voice fluctuations, listening, etc.? So that's very important to presenting. And so you're going to assess yourself, and hopefully you'll be moving toward, if you're not already on, a great deal of a level of active presenting. Thirdly, level of enthusiasm and passion. Because Prevention Plus Wellness programs are motivational, you really want to present your program with a lot of enthusiasm and passion. I would say a great deal if you can, or you could work toward that. And so that's what you'll be assessing yourself. Are you implementing your lesson? Lots of passion and enthusiasm, really, really important, especially when you're implementing a group to a group, especially when you're implementing it to higher risk kids or to high school kids who are at greater risk, because you really want to highlight the importance of this as a motivational intervention. Number 4, level of smoothness or continuousness. That improves over time with practice. Accuracy of following your protocol, very important. You want to make sure that you're using your protocol to guide your presentation of your lesson. Number 6, that you complete the entire lesson. This is very important because we know screening and brief intervention should be done in a single setting. Screening, feedback, and goal setting should all be done in that one period that you have with your youth or young adult. So whether that be 45 minutes or 60 minutes or whatever, you want to implement all 3 components of your PPW program. So that's why you're assessing number 6. You provided your lesson completely. That included screening for their current health habits to increase their wellness, their awareness of their health habits, feedback on those behaviors, including using positive image communication to highlight the benefits and images resulting from those behaviors, and how substance use harms those behaviors, outcomes, and positive images. And then goal setting aimed at helping youth to set goals to avoid substance use and improve protective wellness behaviors. Last measure of this 5-point scale, 7-point item measure is participants' responsiveness. So you certainly want to hope that your participants are aware of what's going on, they're in tune, and we have tools built in like discussion questions, for example, and then participatory things like screening surveys and goal plans that where youth are plenty engaged during that lesson, whether you implement the lesson to one youth at a time, like a tailored intervention, or to a group of youth. The third instrument is fidelity checklist. So this will determine to what extent you're implementing your program with fidelity. And notice there's pre-implementation steps, implementation steps, and post-implementation steps. So under the heading of pre-implementation, you want to make sure that you've been trained to implement your program. Now, we do have step-by-step directions for implementing our program in our manuals. So it is possible, and we do have some individuals that will take the manual and implement it, but in our experience, our very practical, brief 2-hour online training is invaluable to providers because we will walk through the manual, the slides, the online resources, and so you'll really be at a position to really take advantage of this program and get the most of it if you participate in training. So that's why we have as a pre-implementation step to receive program implementer training. And again, it's just 2 hours online, so it's very practical. Practicing your script, as I mentioned before, is essential to implementation quality. And then pre-testing is important. Pre-testing is important for you tracking program outcomes and fidelity. So pre-testing, very important. We'll talk a little bit more about pre and post testing here in a minute. Your implementation fidelity steps include, of course, following your scripts. That's what they're there for, so that you can stay on track, make sure you implement the program with fidelity. Lots of enthusiasm and passion when you implement it all in one setting, screening, feedback, and goal setting, using your PowerPoint slides, and walking you through the goal plan step by step, reading it to them, and then they sign it and you co-sign it. So that turns that goal plan into a contract, which increases motivation for change. So those are implementation steps. As far as post-implementation steps, post-testing at the end of the lesson, so that you can compare a pre and a post, completing your instructor survey so you can track your level of implementation quality, and then reminding your participants to take their goal plans home, to post them, to track their health behaviors over the next 7 days, and then at the end of the 7 days to write a second goal plan to get them into this process, this habit of setting weekly health goals to avoid substance use and to increase protective wellness behavior. So that's the fidelity checklist. Now let's take a look at evaluation designs, and specifically let's start with evaluation designs for assessing risk and protective factors. One minimal design is to simply implement your pre-test that comes with your PPW program, either in paper version or an online version. You implement your pre-test, you present your lesson, and then you implement your post-test. So it's very simple as long as you have enough time. Again, the pre and the post maybe takes 12 minutes to complete, so it's not adding a whole lot of time to your lesson. So that's a minimum. But it's not the best because, again, if you do see change from pre to post, it could be due to other than the lesson. And of course, it's limited to that very small time frame, immediately before and immediately after the lesson. What we recommend now is in the second block, this particular design. By the way, I should have maybe mentioned this, the 0 represents data collection, the X represents the intervention. And so you got 0, 1 is a pretest, X is implementing the lesson or the program, and 02 is implementing the post-test. So you get measure, implementation, measure, all in one setting. That's the minimal design. Now let's look at the recommended design. This is what we recommend for all prevention plus wellness providers. It's an enhanced design. And so you can see what we've added here is we've added a second pretest. 01 is a pretest, and then 02 is a pretest. So 01 could be between 1 and 4 weeks out. And then 02 is the pretest you give them just before the lesson at that moment. And then the lesson X is provided, and then the post-test 03 is collected. So you have 3 data points, 01, 02, 03. So you got 2 pretests and a post-test. So what's the advantage of this recommended 2 pretests over the minimal 1 pretest? So the advantage is this, that you can compare pretest 1 and pretest 2, which has in between a week to 4 weeks, and see if there's any change. And then you can compare pretest 2 to the post-test at the end of the lesson and see if there's any change. And if there's change from the second pretest and the post-test and not from the first 2 pretests, it's much more likely to be due to the intervention itself. So it adds to the quality or the rigor of the evaluation design. Very, very important. And we highly recommend using a 2 pretest evaluation design. Implement the pretest to youth individually or in a group, and then 1 to 4 weeks later, implement it just before the lesson, during the lesson, but immediately before, provide the lesson, and then collect the post-test immediately after the lesson. So that's the recommended design. Excuse me, an even better design is one more data collection. It's where you actually have a 01 and a 02, which are 2 pretests, just like the recommended design, implementing your intervention, having your first pretest 03, but then a follow-up, a first post-test 03, and then a follow-up post-test 04. So this is even the recommended and the better design are really considered timeline designs, improved timeline designs. So the minimal is just a pre-post, the recommended is a timeline, the even better is a timeline, but the even better is even better because you collect 2 pretests, you implement the program, and you collect 2 post-tests. And you can see, the difference, physically, you move the 01 away from 02, you move the 04 away from 03. That means there's a time lag in between there. And that time lag could be, the second post-test could be a month to 3 months after if you wanted to. So have any questions about this? I know this is a little complicated for those of you that may not have been introduced to evaluation designs, but if you have any questions, let me know. I'm happy to clarify for you. You can just write in the chat space. So these are the evaluation designs for assessing risk protective factors using the pre and post surveys that we offer at Prevention Plus Wellness. And again, we recommend at least the second design, 2 pretest implementation and a post-test. If you want to improve that, you can do a second post-test. How about if you wanted to use our behavioral measure, behavioral survey that has the 30-day measures of healthy behaviors and substance use behaviors and others? Well, the minimal design would be the top one. So you've got a pretest, which would be, I would say, 1 month out. It would have to be 1 month because you got 30-day measures. So the minimum would be 01 would be 1 month. And then after that 1 month, you'd implement your second pretest immediately before the lesson and then the lesson. And then 1 or 2 or 3 months, or as long as you want later, you'd implement the first post-test, which is 03. So you'd have 01, wait a month, 02, and implement the program, and then wait another 1 to 3 months and implement the post-test 03. Remember, you've got to have 1 month in between these measures because you're measuring 30-day health behaviors. So you need to have that. So that's a minimal design. It's fine, but it doesn't have any control in it. It doesn't have any real rigor. So that's why we have the recommended design. So the recommended design is, recommended design is just, we just added another post test to that. So a second post test. So you can even do it another, 3 months later, 6 months later, 4 months later. So the minimal design, by the way, is not too bad because you do have a 0.1 and a 0.2 to compare, and you have a 0.2 and a 0.3 to compare. So the minimal design is not a bad design. In essence, it is a timeline design, but the recommended is even better because it has 2 post tests. And also good is if you have a comparison group. That's the last design. You have a comparison group. One group gets the pre-test, and then a month later the program, and 1 to 3 months later the post-test, and another group at the same time gets the pre and the post, but no program. So you have some comparison group, and that will increase the rigor of your design and the quality of the data and the what's the word for it? The your comfort level and assurance that any kind of outcomes that you do see in your intervention group are actually from the intervention and not some noise from some extraneous variables. So that's the evaluation design you'd use if you were to use the behavioral surveys. Let's compare the online and paper surveys, advantages and disadvantages. Go to the left-hand column. The online survey, key advantage, no data handling and entry. That's a beautiful thing. You get your youth to complete the pre-test, maybe 2 pre-tests and a post-test, and by just showing them the link to the survey or the QR code to the survey, you don't even have to touch the data. Another advantage is it increases response accuracy. For individuals that complete an online survey versus, a paper survey, they're more likely to feel comfortable answering honestly. There's, I think, less pressure to answer in a socially desirable way and underestimate the risk for substance use, for example. So chances are the quality, the honesty of the data in an online survey is better than it is for a paper and pencil survey. Also advantage, quick and easy. The main disadvantage for the online pre-post surveys is that it requires some technology and internet. So you're going to have a smartphone, you're going to have a tablet, you got to have internet so that you can hop on and complete your pre and post tests, or pre and post tests, or whatever that you're collecting. If you look at the right-hand column, the main advantage of the paper and pencil survey is that you don't need internet. You don't need, it's low tech. In other words, you just hand out your pre-test survey, make sure your youth have a pencil or pen, they fill it out, hand out the post-test, you can pick them both up, hold them together, and you've got it. But you have to, as a disadvantage says, you have to, it may reduce, as I said, response accuracy, and you have to enter your data. And so it's going to take time and handling of your data. So it's more time consuming, the paper surveys are. So the 3-step process for data collection, if you're using the online surveys, which I would say are preferred because of the advantages right here that we just showed you, the 3-step process of collecting data with the online surveys are right here. Display the customized link or the QR code to the pre-test survey 2 times we recommend prior to the initiation of the program. Then you display the customized link to the post-test immediately after the program, maybe even a second time later. And then lastly, you request data charts and raw data from us because the data has been collected in these SurveyMonkey forms. You can get the charts, you can get the raw data, you could manipulate the data. So it's really, really a good tool. And it's very simple. Your key issue is getting those links or those QR codes to your youth so that they can complete their pre-tests and their post-tests. The steps for data collection with paper surveys are more, because there's more steps and more complicated. Number one, you have to implement your paper survey 2 times prior to the program initiation. You have to implement the post-test immediately after the program conclusion and perhaps another follow-up. Number 3, you have to collect your pre-test and post-test surveys together for later data entry, and you have to use codes to match 3 or more surveys. But then again, you also, in all fairness, you have to have codes to have that additional pre-tests on your online surveys too. Number 5, you have to hand enter your data into a SurveyMonkey form, which we could give you, and then you could request your data charts and your raw data from us. So a little bit more effort, as I mentioned, with data collection with paper surveys. So just to give you a little sense of what kind of data and feedback you can get from your data collection tools. Here's one case study, implementation of the SPORT, which is our alcohol and drug prevention plus wellness single session program. It's evidence-based program. This was a case study out of Neptune, New Jersey. It was done last year, where the providers implemented SPORT virtually online in a group. It was implemented to high school students, and the total number were 33. So you can see in the right hand, you could see that the virtual SPORT program, that 52% increased their likelihood of getting physical activity most days a week, 42% increased in likelihood of eating mostly healthy foods, 21% increased likelihood of taking action to reduce stress, and 66% increased likelihood of avoiding illegal drug use. So those are those intention items, behavioral intentions. Then down below that line are the perceived harmfulness measures, 76% increase in perceived harmfulness of alcohol, 88% increased perceived harmfulness of marijuana, 46% increase in perceived harmfulness of e-cigarettes, and 49% increase in perceived harmfulness of illegal drug use. So I think good and sizable increases in both intentions of engaging in the wellness behaviors, avoiding illegal drug use, and perceptions of risk of harm from substances. These are just 3 quotes from the open-ended items that kids wrote in on their open-ended qualitative items. What did they like best? And here's one from one kid said it showed how to be more healthy and how to avoid drugs and alcohol. That's good. So it shows you the linkage between healthy behaviors and substance use. Second one is it helped me to improve my health because they said a healthy lifestyle can improve my life, including school. So there's that important connection with, success in school. And it motivated me to eat healthier and become more active, which is really a very important thing because we know nutrition and physical activity are lacking in your average high school adolescent in America. Here's a second case study. This one is evaluating the vaping, which is the e-cigarette prevention plus wellness program. It was implemented in Caldwell, Ohio, to a group or groups. Implementation 6th and 9th grades, and the sample size was 165. And you can see up above 97% increase in likelihood of getting physical activity most days a week, which is amazing. 42% increase in likelihood of getting 8 or more hours of sleep, and 7% increase in likelihood of eating mostly healthy foods. So not too much of an increase in foods, but a tremendous increase in getting physical activity and even sleep. As far as perceived risk, 84% increase in perceived harmfulness of marijuana and 50% increase in perceived harmfulness of e-cigarettes, both very important because they're very readily used substances, and so they're developing epidemics, certainly in our country among young people. As far as quotes that they said. I would never use e-cigarettes. I now have a healthy goal, and it made me realize that there's more to look forward to in life and not worry about doing all the things that other kids do, that I have to be on my own individual person. I have to be my own individual person. So that's all very important. Feedback, qualitative feedback from the vaping PPW program. Third and very unique case study is the InShape. Oh, this is the old version of my slides, because that should be taken out. This InShape is alcohol drug PPW. This was implemented in Spokane, Washington, 2 groups. Implemented to the US Air Force, young adults, and the sample was 30. And so the pre to post improvement in behavioral intentions was a 50% increase in some likelihood of getting physical activity most days a week. As you can see, 33% increase in getting 8 or more hours of sleep, 38% increase in practicing stress actions every day, and 57% decrease and using e-cigarettes. Pre-post improvement in harmfulness, you can see there 22% increase in perception that yes, alcohol would harm my health, 27% increase that yes, marijuana would harm, favorable self-efficacy to avoid substance use, 89% were very to somewhat sure that they could stay away from alcohol. 90, I see some hands are being raised here. 93% were very to somewhat sure they could stay away from cigarettes. So we had some different measures for this survey, but nonetheless, very, very good outcomes for these young adults using our InShape program. So if you have any questions, please go ahead and type those in the Q&A or the chat space. So we're just about done, and then I'll take your questions and we can open it up for discussion. Just to show you some of the data that you get from your SurveyMonkey, if you're not familiar with it, here's a post-test online survey, 29 participants. You can get some demographics. So you get a chart, which is, I think, beautiful. And then you get the actual frequencies and percentages of your data. So that's what you get. So those are just these are just some demographics. So in the next year, how likely are you to get physical activity most days a week? So you can see most said very likely and likely. And this was a post test. And then you could actually add up very likely and likely. So you got 62%, and I would say 28%. So you got 6, 7, 8. 90% said that they're very likely or likely to get a physical activity most days a week at post-test implementing this program. So really good data, and again, visually, and then you've got the quantity frequency data. So I just wanted to show you that. And that's it. All right, I'm going to stop at this point. Here's our website. You want to learn more, preventionpluswellness.com. Drop in your email and you'll be notified of our weekly webinars. We're now calling them we're calling them Wednesday webinars, or Webinar Wednesdays. So every Wednesday, we'll try to do our best to have a 1-hour webinar, and they start usually at noon Eastern time. If you want to learn more, go to our website, preventionpluswellness.com. You can always email me at 904-472-5022, or you can email me directly at info@preventionpluswellness.com. All right, thank you so much. And let me see if anybody has any questions or comments. I'm going to open up the chat space. Let's see here. Some people have just said hi. Yes, they could see. So I don't see any questions at this point. There were some people that raised their hands when I was presenting the data on InShape for the US Air Force. So did you have a question about that you wanted to ask, or did you have something comment that you wanted to make, anyone, you're welcome to do that. Just let me know. But I don't see it at this point. So, all right, no Q&A, no Q&A here. Nobody mentioned anything there in Q&A. Remember, I'll be sending everyone a certificate for 1 hour CEU and the link to this recorded session and the PDF slides as well. So you're welcome to please do share them widely with all of your colleagues in your region in your state, and let me know if you need anything else from me here at Prevention Plus Wellness. Let's see here. Thank you very much, Ivan. I appreciate the kind words, and thank you guys. Thanks everyone. Thanks so much for taking time to sit in on this, and we'll have another session next week as well. God bless you guys. Thanks for all you do for youth and families in your areas. Keep up the good work. If we can help at all, at any way from our end at preventionpluswellness.com, let us know. We'd love to serve you any way we can. And stay safe out there. Be careful and take care of yourselves and each other. Bye-bye, everyone.